My name is Mike Veal. We started Positive Behavioral Solutions back in 2014. We actually started a little bit prior to that in 2010 as a private practice. It consisted of Tracy and also consisted of another therapist.
My name is Tracy Ramos. I'm a licensed mental health counselor and the clinical director with Positive Behavioral Solutions. I've been in the field for over 15 years.
I was working behind the scenes. I am the executive director for Positive Behavioral Solutions. In 2014, we felt the need to actually expand into the community. We started off in a very small one-room office and then eventually 3 rooms in our Metro West Orlando office. And in 2019, we actually opened up our large Altamont Springs office.
Our work focuses mainly on children and families.
We actually provide in-home, in-office, and in-school counseling and also psychosocial rehabilitation, which we work with to restore social skills, daily living skills, and vocational skills.
How important is adoption competency training to therapists and providers? Why? Go ahead, you guys.
It's kind of like having a child in front of you that is autistic but has Asperger's. And this one has this diagnosis. It's different. It's completely different.
You're so right, because when you say autism and Asperger's, a lot of these children are diagnosed with autism, but it's overlapped. No, they can mask as the symptoms, but it's really started with a trauma that changed their brains, right?
I feel like there's so many new ways to approach clients that will be beneficial to them that I didn't know before.
With adoption competency, we make it a requirement for all of our therapists, all of our psychosocial rehabilitation specialists, but I feel personally that we need to help those professionals that don't have any idea about adoption and what the overall process is, what the child or the teen or of any age, what they go through. And we tend to focus on the trauma and kind of give them techniques to kind of break that trauma down and to actually empower our therapists to understand where the client's coming from.
With this training, it makes you look through the trauma lens and it makes you look deeper past the behaviors. It helps you understand that, consistency and security and being sensitive and creating that relationship will help adoptees and youth to open up, to realize that, there is a safe place and that they can tell their story. They can be empowered and that they do matter in this world.
And I love that they call this adoption competency training, because that's really what it is. It is becoming competent in a whole different genre and area.
But I learned today that adoption is a culture, that it is a culture to be understood, embraced.
So we want to make sure that they develop compassion, they develop positive warmth and regard, so that the adoptees and their families can be safe and secure in telling their story, and that we help them understand that healing happens through relationships. And if every child has that positive relationship, they can definitely thrive in life.
And when I began my clinical internship, my clinical supervisor, he was like, when you first meet families, you should ask them, like, is this your biological child? And if they say yes, this is the list of questions you ask them. If they say no, this is the list you ask them. And I was like, what?
When I started my career, it was in adoptions and at-risk youth, which I will call now potential youth, because they all have potential. And going through the first year of therapy, I would hear statements such as, these are bad kids, they're felons, they're not respecting us, they should feel thankful. And going through therapy, I tried every technique in the book to try and make them open up to me. What I realized is that after taking my first adoption competency training, it's not about being a therapist full of techniques. It's about understanding the adoptee or the youth, seeing where they're at and accepting where they're at. Understanding that their behaviors are communication to how they're feeling, to what they're thinking, and looking beyond that. They've lost a lot in their life. They had no control. And this training, Adoption Competency, taught me that. A lot of them experienced before being taken away from the parents, or even during physical abuse, sexual abuse, emotional abuse, you know. So that teaches them to not trust the world, or teach them to not trust adults.
Mm-hmm. And I think it's walking that thin line between validating and then also trying to empathize without overstepping into how they're feeling. Because like, you don't know how I feel unless you were ripped out of your home and you have the same experience. You don't know. So that's one of those important things. To start off with, I know how you feel, is not true unless you've experienced it.
Right, that's right.
With older children, I frequently see anniversary events can be a significant event in their life, but it's difficult around the same time of the year that I was initially placed into foster care, or that my mom gave me up, or
yes.
Any important issue.
My personal experience goes back to I was providing social work in a charter school, and I would see the acting out behaviors of the kids, and I would see a difference in, let's say, the ones that were adopted versus the ones that were not adopted. There was more acting out, there was substance abuse, there was some homelessness that I would see. And I became interested as I would meet with them, and they would tell their story from when they were younger and going through teen years. And I realized it was all trauma, but I didn't fully grasp the trauma that was so deeply enrooted in the teens. And so I felt like our therapist, our specialist, they need to understand this. And that's where adoption competency came into play.
We are all going to get so many kickback from case managers, social workers, teachers, even parents. This client is bad, he doesn't care.
Doesn't appreciate.
Why did you do it again? Why did you run away? Why did you steal this car? We're going to get so many of those statements, kickbacks. How would you guys handle that as adoption professionals?
Look at the time frame of, what happened just since, either separation from biological family or even just from the time of adoption. How many transitions has the client gone through? How many schools have they changed? What siblings have they left behind? Are they afraid for the safety of the siblings that they left behind? Multiple traumas, and we're talking about most of this happens in 6 months. How would you as an adult handle one of those losses right now?
Let alone 6. 2 weeks.
And developmentally, this child's not able to process most of this, so of course they're going to act out.
Some adults lose one job and they lose it. But these kids, they lose everything.
They lose everything.
And
All
like,
privacy's gone.
Slip up your bootstraps and keep looking.
Which big
No, you can't do, you can't do that.
When I was about 8 or 9, I had 2 friends that were actually adopted. I didn't understand as a child. I said, well, where's their real mommy and daddy? And I remember having conversations with them, and I was just curious. But we formed a close friendship, and we remained friends throughout. And then at 16, one of them actually died in a car crash, and there was some substance abuse that had happened, and he was driving under the influence, and he got killed. I almost felt like an emptiness too, as well, because we had been so close. And for to know that, what was he thinking during that time? Why was he abusing substances? Why was he drinking? Why was he, doing a lot of heavy drugs? And I asked myself that question for years, and now going through adoption competency, I realized there was trauma. He probably, I don't know for sure, but he probably didn't know how to deal with that. And that was the only way he could deal with it, and it cost him his life.
So when we're looking at the 9 issues of adoption, we're looking at grief and loss, rejection, guilt and shame, self-esteem, relation to identity. And what covers this in children, what covers all of this, again, is the anger, the defiance. What do you think these individuals struggle with in regards to relation to identity? What do they lose?
Where do I come from? Culture.
It kind of makes them feel that they don't belong. They grow in a desire of reaching that belonging stage and it just doesn't get there yet. Doesn't get there because they're different. They see themselves different. They feel different.
And it's also it's complete sense of wonder. It's like, if you don't know who it is, like she said, you're in the grocery store, maybe that could be them. Maybe they've been around the corner the whole time. Maybe, it's just full of maybes.
Think about it, the brain is trying to make sense of everything. And it's constantly trying to make sense of everything.
Yes.
And then that increases anxiety.
Mm-hmm.
So we know they're always going to struggle with these, maybe for life. My personal experience with adoptions and foster care was with my first case that I had. He was a 16-year-old male in and out of the juvenile justice system and living in foster care. And me being a new therapist, thinking I can change the world, it was a hard case. He was very closed off, very verbally aggressive towards me, very physically aggressive. At times he would tease me. There was a little bullying towards me. But what I was taught through school is, never give up and always stay consistent with kids. And that's what I did every session. And I remember thinking every week, why am I here? What am I doing? He's not opening up. Why was I assigned this case? And as I read through his history, it only said he lost his mother and he has no other relatives. I stayed with him for 6 months. And at that point, in one session, he finally opened up. The moment came when I saw a tattoo of a female on, I believe, his left shoulder. I asked about that tattoo. Wow, what does that female on your arm represent? And that's when he talked about his mom. That tattoo represented his mother, who died of, who he lost at a very young age. And he finally opened up about her. During that session. I still remember it like it was yesterday. He was a hard case. He called me all sorts of names in the book. There was a point when I wanted to close him out. But nobody wanted to take him, and he's been through so many therapists. Adoption triad, it involves the parents, the adoptive parents, and the adoptive child. Everyone experiences loss in their own way.
I find through this course, I'm finding my own emotion. Being infertile. And I had no idea what it felt. So it's true, thank you. It is true how much emotion there is in grieving. I just hope that I can be a good adoptive parent.
The
So thank you.
adoptive people
Oh,
that
they
I've
hit me,
spoken
sorry.
to who've had the best experience being adopted, in all honesty, are the ones whose adoptive parents are open and willing to listen to them, and also the ones who can empathize with their loss of their first families and their first mother. Those are the adoptive people who have told me they've had the best experiences.
As parents, they live it 24/7. They experience the child's thoughts, emotions, feelings, behaviors 24/7, and that can be exhausting, on top of their own loss and on top of their own stuff. So having group support is very important. Jean, thank you for sharing. Thank you. It's nice when we're as therapists, we're in touch with our own emotions, our own thoughts. It creates empathy.
Growing up, I did experience trauma. When I was 10 years old, I lost my biological father to suicide, and I felt responsible. And the reason I felt responsible was about a week before he had committed suicide, I had told him that I hated him, and that was due to some physical abuse that had occurred. I remembered back as far as 3 years old. 3 years old up until he committed suicide, I had recalled some physical abuse, a lot of physical abuse, and it affected me to the point that I was relieved that he had committed suicide, but I was also felt guilt. And I have carried that guilt my entire life. And until recently, I started dealing with that guilt and started going through therapy myself to actually understand and to realize it wasn't my fault. And I'm starting to get to that point to realize it was not my fault. Yes, I told him I hated him, but I didn't tell him to pull the trigger. I didn't tell him to go and do that. He could have taken me with him. He could have taken my mom with him, which my mom was pregnant at the time. He could have taken us both with him, or he could have taken my mom. And now I realized if he had, I would have ended up in the foster care system. So even though I buried it very deep and tried not to deal with it all those years, even when we started doing adoption competency, I think that laid the foundation of starting to learn about trauma and traumatic experiences, that all of that started surfacing. When I went through Train the Trainer course with Adoption Competency, there was a story that was told by one of the attendees that she had lost her father to suicide. And she started talking about the feelings that she had and the trauma she had, and that's when I started thinking about it. And I remember getting real teared up in that class, and I had to excuse myself. I had to step out of the classroom. It's difficult to share it. It really is. When I first started sharing it, I would really cry and get emotional and everything. I'm starting to now get to the point that, I'm starting to accept it now, that it was not my fault. And so a lot of the emotions I'm able to cut off a little bit. It gets easier as I keep telling the story. I will never forget about it. I'm learning to deal with it and learning those emotions, but you never forget about it. You never do.
Had a client, and we didn't have a flat surface to actually play Django, and so I just took a little box and blocks. I said, I'll pick questions for you, you pick questions for me. I'm going to answer as many questions as you do, you can always pass. First, no, it's the second block she pulls out. A question that she gives for me to answer for her is, what makes love last?
I'm like, how
Wow.
do I answer that?
I mean, we talked about, love languages and making sure that, love is healthy and that that you know what kind of love you need so that you know what to ask for.
Wow,
See,
that's good.
we can grow up in a loving home, or they say it's a loving home, but then if you're not getting the love that you need, you'll still struggle. Growing up, I knew there was something different about me, and it started at the beginning of elementary school. I felt different. I felt like an outsider, and I got bullied a lot. So what kids would call me, would be either, hey, look at that faggot, why do you walk like a girl? You sound like a girl. And there were many days or many times at home where I would try and correct my walk or try and make my voice deeper. And it kept on going through elementary and middle school. I also felt different because for some reason I didn't have the same feelings for girls as I did with males. It wasn't until the 8th grade that I realized that I was gay, when it finally clicked in. But I suppressed that because I was still getting bullied throughout middle school. And those were tough years to come out as being gay. When I finally shared that I was gay with my parents, fortunately I had very supportive parents and family. They accepted me for who I am and what I wanted to do in life. They were there for me. I had that. And I realized that not many kids, or a lot of our youth, do not have that. And that's why I chose this field, because, whoa, if I didn't have that, what would have happened to me? I would have either been homeless, I would have either possibly been disowned by my family, I would have gotten more rejection and abandonment on top of that. So I realized that, you know, having that, I did have a stable foundation with my parents, and I most likely probably wouldn't be who I am today.
I want to get to know the child for who they are, have my own understanding, let them express who they are without me looking in a file to understand who little Lucy or whoever this is, because that's not who they are. That's that person's perception of them. Exactly. So every single case that comes in front of me, it has to be what I am experiencing with that child. Because what's in there, you've said before, you've gotten one where you're like, none of this stuff, this kid doesn't have any of this stuff, you know, and so it's because the person, maybe the person before didn't listen, or they didn't look, they didn't read, they were too busy, they got too many cases. I can't.
No.
I have to treat each person as if they are the most important person that has been put in front of me, and you have a purpose, and I want to know what it is.
I didn't know that I was going to go into adoption. All I knew is that, you know, I wanted to help youths be safe and encourage them, empower them to be who they are. Because no one helped me throughout my years. You know, I had to fully come to the realization and understanding that you know what, I'm gay. I accept that. I'm going to deal with it. You know, it's still hard at times. It's still hard to be gay even in public, or to be who I am. Because it still goes back to those elementary, middle school years. So if you imagine what kids go through, you know, they take that with them through each stage of their life. So going into adoptions, I realized that there's layers upon layers of loss. I realized that, you know, these kids, these adoptees, they not only lose everything physically, but they lose everything internally, their identity, who they are. And they need help reestablishing it.
Even feeling like they owe the parents something for adopting them, and then parents reinforcing that thought over and over again by saying, you know, you should just be grateful. You don't owe them anything.
Well, I had a client who, during a session, we were playing therapeutic Jenga, and we were asking like questions, and one of the questions is, what is the best gift you ever received? And she looked at her mom and smiled and was like, being adopted. And I'm like, who told you being adopted was a gift? For one, because I think that's what they're being told. You should appreciate this. This is a gift that we're giving you. You could be still in a group home, and that's not going to help that relationship either. And it's talking to the parents, talking to everyone in that child's life, and it's about the verbiage that they're using and what they're saying. And if the child is hearing how they're talking about them in the other room, well, if this behavior doesn't stop, we don't know what's going to happen tomorrow. and how that's affecting that child and them not feeling secure.
Suicide risk is much higher within foster care and adoption. The difference between youths in foster care and youths who have families is that youths in foster care most of the time do not have that stable support system. They do not have that positive relationship. Studies have shown that if a youth has a positive relationship with an adult sometime in their lives, that youth will thrive, that youth will make it through, that youth will become a thriving adult with just that one positive relationship. If a youth does not have any positive relationship, what do you think goes on with that youth inside? You know, rejection, abandonment, nobody loves me, nobody cares for me, I don't belong in this world. Those thoughts can lead to, well, it doesn't matter, nobody will care about me, who cares? My life doesn't matter.
There have been studies that have shown that suicide can be genetic. In my particular family, on my paternal grandmother's side, there was 12 of them, and at least 10 committed suicide throughout their life. And then my father committed suicide. I really didn't find out about that until I started my journey going through therapy and starting to understand suicide and understand the trauma involved. I started finding out about the genetics. And each one of my providers that I personally see have talked about that, and they follow me closely. And that's one of the questions I get asked every time I go into session. Do you have any thoughts of suicide? Do you have any plans for suicide? And I would say over the years, I've thought about it, but when I think about it, I look and see what I have, what I currently have. And I find it spiritually, if I was to take my own life, I think that would be selfish, because there's going to be a lot of unanswered questions behind. And I think, you know, personally, with adoptees, I would think they would think about that and think like, is my life worth living? All the trauma I have been through, is my life worth living? I think that's a question that some may ask themselves.
When adoptees go into home or even foster care and the parents don't want to talk about it, a lot of that is connected with shame. Shame, guilt, secrecy. And in a way that denies a lot on the adoptee's life, the adoptee's own story, the youth's own story. There's a stigma about being adopted or being in foster care, you know, and a lot of these parents don't want to talk about it. And they talk to the adoptee or their children to not talk about it because of the feelings of shame and guilt that's connected with it. There's a lot of loss, there's a lot of sadness. All emotions are tied in it, whether it's happy, joy, anxiety. It's normal to have those thoughts and feelings. It's normal to talk about it. Every time we teach an adoption competency course, we grow ourselves as therapists. And it's exciting to see therapists in each class take this training and also see their growth and apply it out in the field.
Adoption competency also allows professionals to come together to actually learn from each other. It amazes me, in each time that we teach adoption competency, we learn something new from each other. We always have one in every class that we have held that has had some type of past traumatic experience. And it comes to the forefront, and I also find it very healing because I listen to their experiences and I start to realize and actually feel safe. And I started recently telling my story in adoption competency. I started self-disclosing a little bit, and it has been just very rewarding and just very healing, you know, to have support there in that class.
This training is not about teaching exact techniques. Mm-hmm. It's about It's about teaching compassion, learning to look at the bigger picture, and learning to look beyond those outside behaviors, to truly understand what everybody's going through and what their loss is and what the trauma is.
And one particular area of adoption competency that actually changes for each time is actually when you go and you look at the statistics of the foster care system and you look at the statistics of the adoptions, and you see over the year it increases. And I'm like, there's so much more awareness that needs to be out there. It's very rewarding to see a therapist or a professional's kind of the light bulb to go off on their head. And at the end of the day, it makes me feel like I have made someone else aware of what's going on.
Empathy even grows
Yes.
more, right? I mean,
Yes.
you feel more like, oh my goodness, you know, this is like so,
those
you
light
know,
bulbs.
exactly. And so this is an awareness that's like lighting up light bulbs in your brain, and you're like,
Neural
okay, the
pathways.
synapses are working, and now, you know, when you go in there, you'll realize
You're more compassionate.
exactly.
And the questions, I would not have thought to ask some of these most fundamental important questions, like, wow, I never would have even thought to ask those things, and to hear that those are the most important questions to ask.
Yep,
That's gold.
it is.
It's very rewarding to be an adoption competent therapist and to teach the class, because it feels good all round when you know that you've connected with someone and that you know that you're helping them realize their own identity, their own self-worth, and to see other therapists, you know, utilize adoption competency training in the field. And when you see a therapist and the whole team work it and not be judgmental, but accepting of that youth, that's where the reward comes in, right?
I agree.
That's where the feelings that, okay, we are making a difference. If any therapist in the community or in the state of Florida or anywhere would like to know more information about adoption competency training, please feel free to contact Positive Behavioral Solutions, and we will give you that training for free.
We are actually in the process of getting into the telehealth platform, which will allow us to expand outside of Florida. But we've also talked about physically expanding outside of Florida. We feel like it's not just Florida that has all the trauma, and Florida that has foster care and adoption. The whole nation does.
We hope to spread the word about
We do.
adoption competency in all 50 states. So that's our mission.
That is our mission.